New life. Parents dream of a future full of happy moments like these. In the first days of an infant's life, samples of blood are taken to determine the presence of certain disorders like PKU and low thyroid function. These tests have been developed to an advanced state by medical research over the years and are now required by law. Early detection through proper blood sampling can help prevent the tragedy of mental retardation, often a result of these disorders. Jaundice, a condition which affects about 15% of all newborns, is another reason for the procedure. If left untreated, jaundice can also cause mental handicaps. Unfortunately, the technologies available for the blood sampling procedure itself, performed on infants and children up to 2 years of age, have until recently been unsatisfactory. The heel stick procedure, as the blood sampling method is known, has been a highly unpopular one among physicians, nurses, and laboratory professionals.
Well, really, how I feel about it is it's torture to the babies. I guess if I had to pinpoint it, did you ever see the blades themselves, how sharp they are? And if you ever looked at one of those coming at you, I think it would be scary. And it is. It looks kind of like barbaric.
The reason this procedure is so painful is simple. Infant heel punctures bleed from the vasculature at or near the subcutaneous tissue, approximately 1 millimeter deep. Conventional puncture devices stab to a depth 2 to 3 times deeper than necessary. At that excessive depth, not only does the baby experience needless pain and possible injury, but the blood collected is often inadequate, and the procedure must be repeated. When the conventional heel stick procedure is repeated on a sick or premature baby, this becomes an even more serious problem. If the heel becomes bruised or inflamed, the currently recommended safe puncture area shrinks dramatically. It may be reduced to the point where a much more hazardous arterial access must be initiated. A growing number of healthcare professionals have turned to a safer, less painful, more effective alternative, the TenderFoot heel incision device. Dr. Alan Fleischman, a renowned neonatologist, has had experience with both the conventional procedure and TenderFoot.
We do hundreds of heel stick blood sampling within a given week here on neonates and infants. And the TenderFoot heel stick procedure is so far preferable to the old techniques of stabbing the heel because, first of all, we get a sample that is simply drawn, that comes quite rapidly. The procedure also seems to cause very little pain to the infant because the response of the baby seems to be very little as compared to the old technique. Babies virtually don't cry, or if they cry for a short period of time. Also, when we come back to the baby's heel a day later, we don't find the black and blue marks, the ecchymoses. We don't find any signs of infection. And we find that the cut, which is a surgical cut, has healed up very, very nicely. Within 24 to 48 hours, one can hardly see the line of the cut at all. Something that's very important to nurses and doctors is that this is a very safe product. It's not only safe in cutting the heel of the baby, but it's safe in that the blade retracts and the person who's doing the procedure is at no risk after the procedure is completed.
The TenderFoot heel incision device was designed as a direct response to the overwhelming cry from doctors, nurses, and laboratory professionals for a safer, less painful method of performing this universal procedure.
The TenderFoot is nice because who wants to torture anybody? Who wants to hurt any child or any infant? I like to do it fast when I have to do injections or anything. You like to do it really fast and get it done and get it over with for the baby's sake. You never get used to using, lancets or needles or anything, but the faster and the easier that you can make it on an infant or a child, the better it is. That's why I like it. And it makes you feel better that you're not, you can do it a lot quicker and a lot easier for them.
The TenderFoot is easy to use. Dr. Fleischman demonstrates the recommended step-by-step procedure. The recommended TenderFoot heel stick procedure is performed with the baby lying on his or her back. Clean the incision site with an antiseptic swab and allow it to dry. Remove the TenderFoot device from its blister pack, taking care not to touch or rest the blade slot end on any non-sterile surface. Remove the safety clip. Once the safety clip is removed, do not push the trigger or touch the blade slot end. Carefully select a safe incision site. Place the TenderFoot blade slot end flush against the heel so that its center point is vertically aligned with the desired incision site. Ensure that both ends of the TenderFoot instrument are in contact with the skin. Push the trigger. Immediately remove TenderFoot from the infant's heel. Use a dry, sterile gauze pad to wipe away the first drop of blood that appears at the wound site. Fill the collection container, capillary tube, or filter paper to the desired specimen volume. After blood collection, gently press a dry, sterile gauze pad to the incision site until bleeding has ceased. Apply a bandage if desired. Monitor the incision site for 24 hours for late bleeding or inflammation. Please refer to the TenderFoot package insert for detailed instructions before use. The TenderFoot heel incision device evolved from the proven SurgiCut bleeding time test technology. SurgiCut instruments have gained a world-class reputation for precision and accuracy. SurgiCut and TenderFoot are manufactured by International Technodyne, a leader in clinical hemostasis management technologies for over 2 decades. A free educational pamphlet to help educate parents about the heel incision procedure is available by calling 1-800-631-5945 or writing to ITC Educational Services, 23 Nevsky Street, Edison, New Jersey, 08820.